Hello, everyone. I'm Dr. Lisa Sabrina, and today we're going to talk about something most men don't realize they have complete control over their vascular health. Specifically, how you can dramatically improve blood flow throughout your body, including to the areas that matter most for male function, in just 5 minutes using techniques you can perform anywhere, anytime. Now, I know the title might sound exaggerated, but the science behind what I'm about to share is absolutely solid. Once you understand how blood flow works and what restricts it, you can use specific methods to reset your vascular system, reopening circulation pathways that may have been partially closed for years without you even realizing it. The key to understanding this is recognizing that your blood vessels are not rigid pipes. They are dynamic, living tissues that constantly adjust their diameter in response to signals from your nervous system, hormones, and local tissue factors. The smooth muscle in your arterial walls can contract, narrowing the vessels and restricting blood flow, or it can relax, allowing them to dilate and dramatically increase circulation. Most men over 40 walk around with chronically constricted blood vessels, not enough to cause major medical problems, but enough to impair function, particularly in areas with smaller vessels like the genitals. The good news is that you can reverse this constriction quickly using the right techniques. The endothelium, which is the inner lining of your blood vessels, produces a molecule called nitric oxide, the master regulator of vascular tone. When nitric oxide is released, it signals the smooth muscle in your arterial walls to relax, causing vasodilation or the widening of blood vessels. More nitric oxide means more blood flow. As men age, endothelial function declines, leading to reduced nitric oxide production and responsiveness.
This is one of the main reasons for age-related decline in function. However, endothelial function is highly responsive to short-term interventions. You can trigger nitric oxide release and improve vascular responsiveness within minutes using specific techniques. The 5-minute protocol I'm about to teach you combines 3 mechanisms for enhancing blood flow: triggering nitric oxide release,
Activating your parasympathetic nervous system to promote vasodilation, and creating mechanical pressure changes that force your vessels to dilate. When all 3 work together, the effect is powerful and immediate. The first component is rhythmic breathing, with specific timing and technique precisely calibrated to maximize nitric oxide production and parasympathetic activation. You'll inhale through your nose for 4 seconds, expanding your belly first and then your chest to activate the vagus nerve, the main nerve of your parasympathetic system. After the 4-second inhale, hold your breath for 7 seconds. This brief oxygen deficit triggers compensatory vasodilation as your body opens blood vessels to maximize oxygen delivery. Then exhale through your mouth for 8 seconds, making a whooshing sound as you release the air. This extended exhale further activates the parasympathetic system and releases tension in your muscles, including the smooth muscles in your arterial walls. During the 7-second hold, you'll hum, a simple yet powerful addition. Humming creates vibrations in your nasal passages and sinuses, increasing nitric oxide production by up to 15 times compared to silent breathing. Complete this cycle. Inhale, hold with humming, and exhale 5 times in a row. This takes about 90 seconds and forms the foundation of your vascular reset. The second component is isometric muscle contraction in specific muscle groups. Isometric contraction, where you tense a muscle without moving the joint, temporarily restricts blood flow to that muscle. When you release, a surge of blood, known as reactive hyperemia, floods the area, increasing circulation. We'll target the glutes, inner thighs, and lower abdominals, large muscle groups that strongly influence pelvic blood flow. Start with your glutes, squeezing your buttocks together as if holding a coin between them.
hold for 15 seconds while breathing normally, then release completely and feel the warm rush of blood. Next, press your knees together forcefully to engage your inner thighs. Hold for 15 seconds, then release. Finally, contract your lower abdominal muscles by pulling your belly button toward your spine. This also activates your pelvic floor. Hold for 15 seconds, then release. This sequence takes about 90 seconds and creates powerful circulation throughout the lower body. The third component involves dynamic movements that create rhythmic pressure changes in your abdomen and pelvis. Start with pelvic tilts. Stand with your feet shoulder-width apart and knees slightly bent. Tilt your pelvis forward to arch your lower back, then tilt backward to flatten it. Alternate smoothly for 10 cycles. Then perform hip circles, hands on hips. Make 5 large, slow circles in each direction, loosening your hips and enhancing pelvic circulation. Finally, do 5 deep squats, lowering yourself as if sitting in a chair, holding for 3 seconds, and rising slowly. These movements mechanically massage your internal organs and blood vessels, improving blood flow and nerve responsiveness. Together, these exercises take about 90 seconds, bringing the total protocol to 4.5 minutes.
Use the final 30 seconds for vascular visualization. Close your eyes and imagine warm, oxygen-rich blood flowing freely throughout your body, especially your pelvic region. Visualizing warmth and circulation can genuinely enhance blood flow. As shown in thermal imaging studies, this mental step amplifies the physical effects.
You can do this protocol 15 to 30 minutes before you need optimal function for immediate results, as its effects last several hours. For long-term benefits, practice daily, ideally in the morning, to progressively improve vascular responsiveness. Many men notice significant improvement in function within 2 to 3 weeks. You can even repeat the protocol multiple times a day, morning, evening, or whenever you have a few quiet minutes. Advanced enhancements include temperature contrast therapy, alternating warm and cool water on the lower body after the protocol trains your blood vessels to be more responsive, and acupressure, pressing specific points near the inner ankles and lower abdomen to boost pelvic circulation. Body position can also enhance the effects. Doing the breathing portion while lying on your back with hips elevated helps gravity assist blood flow, while reclining during isometric contractions allows stronger muscle engagement. Hydration is another key factor. Since blood is over half plasma and plasma is mostly water, dehydration thickens your blood, reducing flow, especially to smaller vessels. Drink enough water so your urine is pale yellow, and have a glass of water about 30 minutes before doing the protocol to ensure optimal circulation and nitric oxide production. Also, avoid performing the protocol right after a large meal. Wait at least 2 hours so blood isn't diverted to digestion. Regular practice of this vascular training not only improves blood flow temporarily, but also strengthens your endothelium, the lining of your blood vessels, leading to lasting vascular health. Studies show men in their 60s and 70s can restore endothelial function to much younger levels through consistent vascular training. Chronic stress, on the other hand, constricts vessels via the sympathetic nervous system, so the breathing component of this protocol is especially effective for stress reduction. Many men benefit from doing the breathing exercise alone multiple times a day as a relaxation tool, and the full protocol once or twice daily for maximum vascular benefits. In the first week, most men notice feeling warmer, especially in their extremities, as circulation improves. By week 2 or 3, morning performance and responsiveness improve, and by 4 to 6 weeks, many report returning to levels they haven't experienced in years. The improvements often continue with ongoing practice, helping you maintain youthful circulation and vitality. Thank you for watching. If you found this valuable, please subscribe for more evidence-based content on optimizing your health. Until next time, this is Dr. Lisa Sabrina reminding you that your vascular health is trainable, and just 5 minutes a day can make a profound difference.